I conned this entire family into thinking I'm Pete. But now they mean everything to me.
On March 9th.
Hey, Pete, take us to the $11 million. You got 72 hours before we start clipping your family.
If we don't do what these guys want, we're all dead.
Every con
There are too many secrets in this family.
has consequences.
So how are you gonna pull this off? If you say go tonight, they will go tonight.
The new season of Sneaky Pete returns March 9th on Amazon Prime Video. Season 1 available to stream now.
Blog Talk Radio.
World won't get no better if we just let it be. Na 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 na. The world won't get no better. We gotta change it, yeah, just you and me.
Welcome to What's New with VHHughes. I am your host, Venus Henderson-Hughes. In the studio with me today is Regina. Hello. Good morning, Regina. How are you this morning?
Cold.
And it's a little chilly here in Arizona. I think our temperature, what's today's temperature on the books for us today, folks?
63.
Today's temperature outside is a blistery 35 degrees.
Shoot.
So it is a little cold inside of the house, so we got the heat on. We're talking about Black History today, and I wanted to start first off with saying, again, Happy Black History Month. But I wanted to also begin with talking about National Heart Value Disease Awareness Day, which was February 22nd. And if you don't know what that is, National Heart Value Awareness Day happens annually, and it is increasing recognition on the specific risks and symptoms of heart valve disease to improve and detect treatment and ultimately save lives. So this is dedicated to a number of people who may have lost their independence due to heart attacks, arrhythmias, congestive heart failures, and other heart disease.
Can you have that prevented?
Prevention is always a key, and of course, when we talk about prevention, we go into the other part of the show where we talk about going to see the doctor. So a little bit about the alliance that handles the heart valve Disease Awareness Day. They started in 1986. And they have been recognizing the seriousness of this disease and the fact that the disease symptoms, I can't speak today. Disease symptoms, they go undetected. And so some people are out there and may have a heart valve issue and have no idea. And of course, when they find out, is usually going into surgery or, unfortunately, after death. The family finds out.
What are the symptoms?
So some of the symptoms. Complications. So let's see. So the usual things that you have where you may mistake it for something else: chest pain, shortness of breath, being tired, weakness, inability to maintain your regular activities, lightheadedness, swollen ankles, feet, or abdomen. That's something. And I say we collectively as a people may dismiss some of the things, or may think that it may be something else. A lot of times I know that I found out some years ago when I was still in Michigan, I was having a pain in the center of my chest. And so when I went and they hooked me up to the EKG machine, my heart was fine. But it turns out that the cold that we experienced in Michigan had caused a bit of arthritis to come into my breastbone. So that's where that aching came from. So thankfully my heart was okay. And thankfully I went to the doctor to see about that and not have it progress to something else because I didn't go or refused to go or whatever my choice was. So the whole purpose of this day is to educate people about heart valve awareness throughout the year. It's not just for the day, but the day starts, I guess, the progression of the year and informing people about the importance of, one, going to see your doctor, and two, being aware of how your heart operates, because, of course, February is Heart Healthy Month. Yeah. February, of course, is Love Month when you talk about Valentine's Day and things like that. But in order to love, you must love yourself first, and making sure that you are healthy starts with going to see the doctor. And I keep going back to the going to see your doctor thing because we're going to talk about the disparities in the black community because, again, it is Black History Month. And although we have so many medical advances and so much technology, if you will, to help us maintain healthy lives, we can maintain healthy lives. We live a lot longer than we used to. There used to be a time when the average age of life was in your teens, and we have people living well beyond that. We have some people in their hundreds. So,
just like turtles.
Well, turtles can live thousands of years. We haven't gotten that advanced. However,
one day they will find it.
One of the things that I look at as far as some of the technological advances that are happening in science and medicine, some of them are beautiful and some of them are really disturbing, especially when you start cloning things. And I know that right now there is a ban on cloning humans. However,
they clone animals.
They've been cloning quite a few different animals, and so it just makes you wonder. So I guess my question is, with all of the advances that we do have, how do we as black people measure up? So I took a look at our friends at the Center for Disease Control and Prevention, or as we call them, the CDC. And it says that African Americans are living longer. Yay, us. Woo! And then it says that the death rate for African Americans has declined about 25%, so 1/4 over 17 years. Primarily for those aged 65 years or and older. Now, this is based upon health analysis. This is not based upon all of the other causes of death for us. And of course, we know that we as African Americans can be shot and killed and things like that because of whatever reason. The biggest issue is, it says, chronic diseases and some of their risk factors may be silent or not diagnosed during the early years. And this is what's causing us to be at that low range. Even though we are still living longer, we're not having the prevention that we should be as African Americans. So let's look at the death rate, shall we? So the death rate for African Americans decreased 25% from 1999 to 2015. And it says African Americans age 18 to 49 are 2 times as likely to die from a heart disease than whites. So, okay, Gina, that's our demographic. You're 19, I'm 45. That's what we are. That's a scary thought right there, right? So we're right there in that groove. Wow. So that's really eye-opening. It says African American ages 35 to 64, still I'm in that bunch, so you left that, are more likely to have high blood pressure than whites. I do not have high blood pressure. Shout out to our other co-host, Chris Hughes. He's at work today, so we're missing him, but he unfortunately is in that demographic that was just left. So, okay, here's the problem. Young African Americans are living with diseases more common at older ages: high blood pressure, diabetes, and stroke. And it says that they are more likely to die at early ages from all those causes. So 18 to 34, your demographic, 12%. That's something right there. 12% in high blood pressure. 18 to 34, 1.5% in diabetes, and 7-10% for stroke. 18 to 34. My demographic, 35 to 49, high blood pressure 33%, diabetes is 10%, 35 to 49, stroke 35 to 49, 2%.
Wow.
For 50 to 64, the rate goes up 61%, diabetes 50 to 64, 23%, and stroke 50 to 64, 7%. And it says that the leading causes of death in African Americans, they have increased, but the question is what is the causes of that? So some of the causes that they believe is unemployment. So from age 18 to 34, 13% are unemployed, 35 to 49, 8% are unemployed, and from 50 to 64, 5% are unemployed. Living in poverty is another cause. 25% from age 18 to 34 are living in poverty. 35 to 49, 19% living in poverty. 20% for ages 50 to 64 are living in poverty. Now they mentioned no home ownership, and I'm wondering how this is a cause on our health risk. But again, it's listed, and so from age 18 to 34, 69% have no home ownership. Well, at age 18, a lot of people are not thinking about buying a home, so I can see that rate. 35 to 49, 57% have no home ownership, and it's pretty close to the 18 to 34, which is really interesting. And
so what do they mean by home ownership? Do they mean like actual home, or
buying your own home or condo? Because condos are you can buy those as well. So your house that you have a deed and own. 50 to 64 age demographic, 45% of those do not own homes. Now, going back to our subject matter again, could not see a doctor because of cost, which is a huge thing. When I tell you that these percentages are right next to each other, this is staggering. But in the age demographic from 18 to 34, 19% of them could not see a doctor. 35 to 49, 19% of them could not see a doctor. And from 50 to 64, 18% of them could not see a doctor.
At one point.
So by 1%. Smoking is another factor.
Of course it is.
18 to 34, 19% of them smoke. Age 35 to 49, 20% of them smoke. And 50 to 64, 24% of them smoke. So the older people actually took the lead in that one. Not being active, 18 to 34 age graphic, 26% of them are not active. 35 to 49, 30% of them are not active. And 50 to 64, 35% of them are not active. Obesity is, I think, our last one. Yes, obesity is the last one. So for age 18 to 34, 29% of them are obese. 35 to 49, 43% of them are obese. And 50 to 64, 43% of them are obese. So the question was, what can be done? And besides the government collecting and tracking data on poverty and things like that, and addressing all the governmental things, what can we do as a community? We definitely need health promotion in our schools and our home. We need to help people go see the doctor. We need to have those people be able to get their medications, and also to have their follow-up appointments. As a public health person, I have programs that can help with that. Definitely wanting to make sure that the community in itself stays healthy. That's why we exist. Health literacy is to make sure that you can understand what the doctor is telling you and how to apply it to your life.
That's why health fairs are made also.
Health fairs, a lot of times people look at health fairs as a place to go get stuff. But especially when we did our H3P health fair, we set that health fair up in order for us to be able to provide health care to a community, especially for those people who cannot see a doctor. So that was my goal, and that is always my goal when it comes to our health fair. Join the conversation, area code 516-453-9934. So we kept talking about the doctor and African American people, and where did this come from? Where did the whole idea that doctors are not valued for what they can do? Did this just fall out of the sky or what? So, of course, we know about what is wrong with me? We know about the Tuskegee syphilis study that was done, or if you don't know, can you tell us about the Tuskegee syphilis study? I'm putting you on the spot.
Yeah, you're putting me on the spot. So, it was a study that the doctors basically they played these people and thinking they were going to receive Medicare for their illness. So for medicine to fix what they have. But little did the people know that they rounded up to be in the study. They were just seeing what the effects of syphilis was going to be on the body and the mind.
So the well-documented legacy of racial discrimination towards African Americans, and this is coming from Race and Trust in the healthcare system. This was done by a group of people, and it's a research article. And they look at the fact of race in healthcare with regard to especially African American people, and they speak about the Tuskegee syphilis study. And in this study, just how, one, the then CDC or the Department of Public Health lied to these African American men, stating that they were going to help them with their bad blood issue. And it initially involved 600 black men, 399 with syphilis, 201 who did not have the disease at all. And the study was conducted without the benefit of the patient's informed consent, which is why now we do have, when you go to the doctor, you have to sign those paperwork for informed consent. Researchers told the men that they were being treated for bad blood, a local term used to describe several ailments, including syphilis, anemia, and fatigue. In truth, they did not receive the proper treatment to cure their illness. What these men received for taking part in the study was free medical exams, free meals, and burial insurance. Although this whole process was supposed to only last for 6 months, this process lasted for 40 years, which is frightening that this took place in a rural town. And the fact that even when some of the family members picked up on the weirdness that was going on and took their family members to a real doctor,
they were hunted down and brought back.
So, okay. So I can see why black men wouldn't want to go to a doctor. I could see that. And as a matter of fact, there is a study done out of Ann Arbor, Michigan, that says that black men don't want to go to the doctor because the visits are stressful and the physicians don't give adequate information on how to make prescribed behavioral lifestyle changes. Now, is that a fair statement with regard to doctors, or is it that the black men just don't have the right people giving them the clarity of what the doctor is saying? Because there's right there is a case of health illiteracy. You know, they're saying that they don't understand what the doctor is saying, but do they have a place where they can go and get clarity on what the doctor is saying? The being stuck on, like, diet and exercise, of course, that's across the board with every single solitary doctor's visit that you go to, whether you're fat, skinny, in between, whatever. You want to maintain a healthy lifestyle. But what if there's more to it? What if it's okay, not only diet and exercise and eating healthy, but taking time out to have time, you know, where
have
you're
time for yourself.
Right, have time for yourself where you clear your head and your mind and not have to deal with the hustle and bustle, and that can de-stress you. But what if that's missed because you don't understand what the doctor is saying? So that in itself is interesting. I know for a fact that growing up, especially with a grandmother from the South, she was not a let me go to the doctor and see about myself kind of person. However, she did go, and I don't know if it was prior to her having a heart attack. My grandmother had a heart attack, but at some point she did get to the point where she regularly went to the doctor. She did have the checkup. She did go see about herself. It wasn't a case of her not having health insurance. I think it was just the fact of the stigma that probably goes on, especially in the South, of not trusting doctors, regardless of color of the doctor, because, of course, we know that going back to the Tuskegee study, the nurse that was associated with the doctor, the CDC, was black. So now you have made this huge stigma against our people as well because you've included them in on your scam. So I don't know. I've had my own experience with not wanting to trust a doctor. When I had my daughter that passed away, that doctor mixed my medical records up with another person, and that person was HIV positive, and they placed that person's records into mine when copying the paperwork over, and basically had me thinking that I was going to die real soon, only to find out that that wasn't my record. That's a sad state of affairs, and that could have took me down a lot of dark roads, but luckily I can read, and luckily I can ask questions, and I did get the right answer to everything. But those are scary thoughts, especially when careless things do happen in health departments, in doctor's offices. There are things that can happen, and that could take people down some dark places as far as not wanting to trust a doctor. Self-diagnosis. I went through my own state of self-diagnosis that ended me in emergency surgery last year. So because what I thought was gas turned out to be me needing to have my gallbladder removed. Go figure. I started off thinking it was gas. Yeah. I thought it was gas, so I went and got me a nice cup of Vernors, and I kept drinking the Vernors. I still was in a lot of pain, and finally my husband drugged me to the ER, and the ER doctor said that I had gallstones, and I was like, what? And we thought that it would be 30 days till I would have to have it removed. It turned out it was within 3 days, I believe, that I had to have it removed. So self-diagnosis is not a good thing, no matter if you are a doctor or not.
Yeah, doctors see doctors too.
Doctors see doctors too.
But yeah.
Yeah, doctors do have their own doctors. Everybody has their own backup person. And that's a good thing. That's checks and balances in a good way, not in the governmental way, but to make sure that you are correct about what you believe or perceive is going on. No, I am not a person to go and try to self-diagnose myself on WebMD. The fact of the matter is, when I thought that I had gas, it felt like gas. It just felt like I just needed to burp. And the burp just never happened. And so, but as time went on, and we're talking like an hour or so, and I hadn't burped, or when I did burp and I didn't receive any pressure release, that's when things became much more concerning. So what can H3P help with getting our community and our stats looking better as far as the black community? One, we are designed to help you understand what healthcare is, how to apply it to your life. And this is more than just diet and exercise. This is being able to go into your doctor, understand what the doctor has said to you, and how to best be the best healthy version of yourself. This is why we exist. We want you to be able to understand how, one, if I take this medication, it's going to do this. If I don't take this medication, it's going to do that. Which world would I rather live in? If I don't see my doctor regularly, this is going to happen to my body. If I do see my doctor, so our cause, we definitely deal with cause and effect. We actually have a caller.
Hello.
Good morning, caller. How can we help you?
Good morning. Good morning, Venus. It's Stephanie. How are you?
Gina, Stephanie's on the line. You have any questions for us?
Well, not necessarily a question. I was listening to your show about how African American men, mostly, if I heard correctly,
right,
don't like going to the doctor. And I remember when you went to the hospital. Unfortunately, as they say way back then, men and women didn't go to the doctor. The only time my father ever went to the doctor is when he found out he had cancer. And he was already in his 60s. He detests hospitals. And it's that, I don't know, the way they're raised or what the case may be. Even for myself, when I found, I was told once I had endometriosis. I was in my 20s, had never heard that word before, scared me to death, and I had the most prominent doctor, Dr. Charles Wright, in Detroit, Michigan, tell me I had endometriosis.
Oh, wow.
And I was in, I'm sorry?
I said, oh, wow, Dr. Wright. Yeah, good doctor.
Yes. He was my doctor. And I remember him saying I was actually in the hospital with a kidney infection. When he told me I had it, and he said, once we treat this, I want you to come back. Because once we treat your kidney infection, I want you to come back because we need to discuss this other. And I'm looking at him going, hold that thought. And I didn't go back. And I didn't go back. And I kept getting the infections and so on and so forth. And let's just say by the time I went back to him and got 2 other opinions, I had cancer because I didn't take care of my health. And the endometriosis had spread to the point I had 9 pounds of disease and 2 tumors. So, yeah, you know, we get a phobia, or if we haven't heard of a certain disease or a word scares us, then we don't know. I don't know if it's we don't know what to do, but we're afraid to do whatever we're supposed to do. I believe
that when it comes down to a lot of us, and that's across the board, not just black people, but everybody, I think a lot of us have already said, I don't want to know because I'm scared of whatever it is.
Exactly.
And I think that whole, what is it, no news is good news type thing. But the thing is if you don't go get the news,
you can't figure it out.
Exactly. So you have to know where to go.
Exactly. Endometriosis was a very misdiagnosed disease.
Yes.
It's very prominent in women, and women don't know that they have it. Because, well, it's more prominent now, but back then, I'm talking more than 30 years ago, it was a very misdiagnosed disease because of the symptoms and so forth that you have. So you didn't equate it with cancer or anything. You just thought you had a little disease. You could take a pill and it would be okay because you didn't go back to the doctor, or you were misdiagnosed or whatever. And especially with young people now, you know, you have to, with sex being the way it is, with drugs being the way they are, you have to be so extremely careful. And parents, pay attention to your children, especially in the teens and, you know, on up into their 20s.
Yes.
And you're right, it is across the board. It doesn't matter what race or what ethnic background you are. No disease, they don't care. If it can attack your body, it will, because we don't know or we don't take the time to find out. So it can be very scary. It was scary to me.
It was definitely scary to me when I was in the ER and not knowing. And like I said, self-diagnosis will take you out of here. So that is definitely the thing that I advocate, not only to people, but for myself as well. I'm not immune, and I tell people I'm as human can be. Yes, I know a lot of facts and figures, and I do a lot of research, but I have just as many times where I want to go, oh, okay, it's not that, it's it, you know. But arrogance will put you in the hospital. Arrogance will put you in a grave early. So we have these people out there, our nurse practitioners, our doctors, our nurses, there for a reason. They all went to school for a reason. And even though majority of medical science is trial and error, some things have been proven to actually work.
That's true. And then we have a bad habit of going online and saying, oh, well, I feel like this or I feel like that, and then somebody else starts talking about how they feel, and they're like, oh, you know, I have those same symptoms, and then they go online, and you're right, they self-diagnose. I've done it more times than I care to talk about. And self-diagnosis will put you in one of the many cemeteries that we have out here.
Yeah.
So you're right. Doctors and nurses and all those powers that be did go to school for a reason, and they're there for a reason. We need to come out of our heads and our own, I'm not sure even what to call it, and just, you know, take off the mask, take off the pity party, get rid of the fear, and know that there are doctors and hospitals and so forth that out there for a reason. And
absolutely.
That's what they're there for.
That is exactly what they're there for. Well, Stephanie, thank you so much for calling in.
You're very welcome.
A wonderful surprise for us.
Hey, you know, every now and then I get there.
I know, right?
You ladies have a great day.
You have a great day, too.
Thank you.
Bye-bye.
Bye-bye.
Well, this has been What's New with VHHughes. We have had a wonderful time with you. Have a great day. Have a great rest of your week. Bye-bye.
What a matchup!
And what a team, Mike. Metro PCS and the iPhone SE for $0 on a network that covers 99% of people in the U.S. Oh, impressive.
Play with the best. Switch to Metro PCS on an unlimited LTE plan and get a 32-gig iPhone SE for $0. Metro PCS. Coverage not available in some areas, plus sales tax. Claim based on talk and text. Not valid for active numbers currently on the T-Mobile network or active on Metro PCS in the past 90 days. See store for details and terms and conditions.
Support for this podcast comes from the University of Texas MD Anderson Cancer Center, ranked one of the top cancer centers in the nation for the last 27 years. The doctors at MD Anderson treat more rare cancers in a single day than many physicians see in a lifetime, and treatment plans are tailored to an individual patient's needs, allowing more comprehensive and thorough care. To become a patient, please visit makingcancerhistory.com.